Hi everyone, this is Dolores Montero. I wanted to go over some information with you to help you keep track of the Medicare Part A and Part B changes in the SNF setting that are as a result of the public health emergency and the temporary changes due to COVID-19. The rules have been changing rapidly since the start of the public health emergency last March in 2020. And right through till now, January 2021, there's been quite a few things to keep track of. So I merged all this information here for you so that we can look at what's changed for Medicare Part A, what is in place right now, the changes from the waiver and other changes that have been implemented for Part A, and then look at the Part B changes as well. Because there were some temporary changes, that telehealth being the most prominent one that's changed frequently in the last year, combining those changes with what took place 1/1/21 with the physician fee schedule final rule. So there's a lot of overlaying things here, and this should help outline for you what's what at the current moment. Again, this information is current as of January 2021. It is possible that this information could change tomorrow or the next day, but we hope not. What we do know as far as the waiver itself, that was just renewed again for the fourth time, and that will last us through April 20th. So we'll go over those changes, but this information here should remain current through April, barring something crazy or an end of the public health emergency declaration, which I don't see happening at this point, given the status of things nationwide. So we know we have tons of rules to follow. We have rules coming at us in every direction, and now we have these national emergency rules, the disaster relief rules, and waiver rules. So these rules can modify or be in place on top of any of the other rules that we have to follow in the SNF setting, whether it be federal rules or state rules. Some of our Practice Act rules aren't changed necessarily by these waivers, but our states may enact temporary or permanent changes to our discipline practice acts because of what's going on. So that's something that we need to keep on top of as well. So just backing things up a little bit, we know now that when the president declares a disaster or an emergency and uses the Stafford Act or the National Emergency Act, that's when things change. So Section 1135, and you've probably heard a million times by now, the 1135 waiver is really waiving Section 1135 of the Social Security Act. It's waiving things that have to do with Medicare, Medicaid, and other things like that. So I want to show you a couple things because there's a lot of rumor out there with all of the changes too. So I want to show you a few things that you can have as a reference, and you can download these slides to have all these links as a resource as well. So the original declaration of the 1135 waiver, so waiving that piece of the Social Security Act, came out back in March of 2020, and it was made retroactive to January 2020. So this is the actual waiver itself. This is what the letter looked like from our HHS director, Alex Azar. So you can see that here. It's the actual letter. There is mention in the letter of what is being waived, some things under Medicare Part A, and we'll get into that and Medicare Part B as well. So because this happened in March, there was implications for Part A and Part B. And it's a federal waiver, so all these things being waived apply to all the states as well. All the federal things apply to states. But states are also governed by individual state Medicaid, and this waiver doesn't necessarily cover that. So this is really a federal waiver, and then you have to know what your individual state did. Did they go along with this waiver? Did they apply for it and get it, or did they not? So that's something that you need to look up individually. But these waivers, the 1135 waiver, when it was put out, the waiver is intended to be used for 90 days, and then it expires unless it is withdrawn before then. Now, we've had 4 renewals of this waiver up till the date of this presentation. So we lasted well more than the 90 days that it was intended for. So the waiver was done in March, retroactive back to January, and then it was done again in July, October, and then most recently, the first week of January, with a start date of January 21st, it was renewed again for 90 days. So we're looking at a next expiration date of April 20th, 2021, unless something is stated before that, whether the PHE ends or it will be renewed. And if it is renewed in April, which I suspect it will be, chances are that will happen very early in April. We haven't been waiting till the expiration date to renew things. We've been receiving that a couple weeks in advance. Okay, you can keep up with those changes here. There's a link at the bottom of the slide where you can actually see everything on your own. There's a link on this slide that shows you what the actual declaration of renewal looks like. This is the one that we just had. It states here that it was renewed effective January 21st and for 90 days. So we have an expiration date of April 20th unless something changes. So you can keep an eye on that link as well. Now, the main thing for Medicare Part A that happened with the 1135 waiver was in the skilled nursing facility anyway, because things happened in all settings, but specific to the SNF, this waiver accomplished two things. It changed the 3-day hospital stay requirement that we know that is a technical requirement to initiate Part A in the SNF setting, so to open up that benefit period of 100 days, and also temporarily changed the 60-day spell of wellness, which is the other requirement that in order to initiate a new benefit period of a new 100 days, there has to be a 60-day spell of wellness with no hospital admissions or no skilled care provided in the SNF setting for those 60 days for things to reset. There's a link here to an important document, which we'll talk about a few more times, that has the specific information regarding this. We'll get into both of these in a few slides. Just wanted to show you first, this is the actual 1135 waiver. So this is what it looks like. This is what Seema Verma, the administrator for CMS, took that waiver and enacted some things upon it, specifically what we just talked about, the hospital stay and the benefit period waiver. So we'll look at all of that information in detail in a few seconds. First, just want to give you another resource slide so you can click on all of these links. These are all really important links with the information that changes as things change. So you shouldn't need new links. You should be able to use these links even if things change down the road. Really importantly, if you go down to this section here, the 1135 waiver general information, you can turn to page 33 specifically and see the questions that were asked in regards to the Part A waiver, so the hospital stay and the benefit period, and you can actually see CMS's answers. So those are where the answers are. You're hearing a lot of answers out there, I know, but this is where they actually are. And there's also a waiver document at the bottom, a link to that on page 39 that goes through, I'm sorry, this is not a waiver document. This is the emergencies that are implemented, that can be implemented without the waiver. So we're going to take a look at that as well. So the details of the 3-day stay, so that piece of technical criteria that is currently being waived is the actual 3 midnight hospital stay. Now, this intention of this waiver, it was not a blanket rule to make all residents in the SNF setting Medicare Part A, waiving the hospital stay. It really pertains to and opens up situations where the resident may not be able to go to the hospital, but normally would, because either there's COVID in the hospital, there's something that has to do with COVID that's preventing the hospital admission. Maybe the resident has COVID and they're isolated in your facility and things can be managed there. So it really is tied to the emergency. So we've definitely heard things of facilities making everyone Part A that was on therapy for Part B before this all happened, just really converting everyone. And then every time a resident gets sick of any sort of anything, starting a Part A service. So that's not the intention of this. and we'll get into a little bit more of that and where you can find that information. But the resident does not need a 3 midnight hospital stay, doesn't even need a hospital stay. In fact, you can initiate the Part A benefits if this situation applies to them. There's a link here. It'll bring you right to the page that is specifically answering your questions about this 3-day stay. The 60-day spell of wellness span. Now CMS has been very frank with this, and they are looking at this one a little more closely and requiring more justification with this than they are the 3-day stay. They have said that the 3-day stay doesn't require additional documentation. However, if you're using the 60-day spell of wellness waiver, you are actually going to have your claim manually reviewed by CMS. So a human is going to look at that and know, where you live, what your region is, and what's going on in that region, comparing the requirements and maybe the rationale, the documentation you're providing for using the waiver against what's actually going on. So please know that that's there. In July, CMS put forth a FAQ document that answered a lot of the questions that were going around, as well as answered questions in their provider calls. So this 60-day spell of wellness, what it does is it allows one additional 100-day period. So in addition to the 100 days, the benefit period that a resident is able to achieve, this piece of the waiver will allow another 100 days if that resident was prevented from renewing it the right way, which is the 60-day spell of wellness. So if that 60-day spell of wellness couldn't happen because of the public health emergency for some reason, this lets the new 100-day span open. So a really good example would be if you just completed 100 days with your resident who had a hip fracture and went through the whole 100 days of therapy, came off therapy, and a week later developed COVID symptoms, you could initiate, because that 60-day break wasn't able to happen because of COVID, you could open up a new 100-day period. Now, again, this is a case-by-case basis, so I'm just giving you a general example here. So that would be a potential. It would also be a potential if your resident used 90 days of therapy for 90 days of skilled coverage for that same hip fracture, was cut on day 90, stayed in your facility, and got COVID a week later. You could open up the benefit period and use the rest of the 10 days that the resident had, and then progress into another 100-day benefit period if COVID became a skilled need. Okay, so that is what that is there for. It does not give everyone a blanket second 100 days. So there has to be rationale for that. There's links here where you can actually see CMS's words for yourself. I put a chunk of that information here on this slide so you can see the questions and answers that are right in the documents that have existed before this public health emergency. So the first question, can CMS waive the 3-day qualifying hospital stay? You can read their answer. And the second one is the new spell of wellness. So you can kind of get CMS's gist on what they're trying to do with the waivers and what their intention is. Some other things that were waived were the MDS submission requirements, just making things a little more lax for the actual transmission of the MDS, knowing that MDS coordinators might be pulled to the floor to provide care during the emergency. What did not change is anything having to do with the criteria for skilled care and coverage. So if you're covering a resident under Medicare Part A in the SNF, the reason you're doing that has to be the same reason in Chapter 8 of the Medicare Benefit Policy Manual that have those reasons that have always existed. Okay, so there's no alteration to that. Okay, skilled care is skilled care. Now, the waiver also made some impact on Medicare Part B in multiple settings. We're going to talk specifically about the SNF setting, but telehealth is something that spans multiple settings, and it's really important to know about telehealth, which is a function of Medicare Part B, that telehealth was not even a thing for therapy before all of this. So telehealth had its own very specific rules. It was for medical professionals, for physicians, it was for those patients that lived in rural areas and were hard to access. So there was very specific rules and codes with telehealth. Therapists are not considered providers under telehealth. It's been something all of our associations have been fighting for a while, but that was not the case right up through till not that long ago. So therapists, again, not approved providers. There were some changes with the waiver, and then there was an interim final rule that came out, and telehealth changed little by little, and our professionals in our associations were really just advocating with CMS on provider calls and really along the way to try and get that overturned for at least the public health emergency to let therapy have some play in the telehealth arena. So that actually did happen in May. So towards the end of May, CMS made the announcement that the Part B residents, therapists could provide telehealth to Part B residents. There's a link here where you can actually read when that happened and what happened with that. The other thing that happened with the waiver changes were maintenance therapy, where CMS was trying to free up all of the providers possible. So what they did was they temporarily approved PT and OT assistants to provide skilled maintenance therapy in the Part B setting, which was not a thing before. Their assistants were only allowed to provide skilled maintenance therapy in the Part A setting. So that was temporary. But then what happened was in the Medicare Part B final rule, which kicked in on January 1st, 2021, this was made a permanent change. So as it stands and going forward, assistants can provide Part B skilled maintenance to residents in the SNF setting, in the outpatient setting. So that's no longer under the waiver. So that was, and then it was pulled out and made a regular rule. There's some links here too where you can try and keep up to chronologically what has happened on the bottom of the slide here. This is one of the graphics that you can find in the toolbox on the website, or you can print this slide as a full slide. This just helps you sort out the changes that are current as of right now as well. So these are the specific to therapy and specific to Medicare Part B. So it goes through virtual services. So virtual services under Part B is the overall category, the umbrella category, and that's where telehealth is. So telehealth is under a virtual service. It's one of the types of virtual services that can be provided. The other three are virtual check-ins, e-visits, and telephone evaluation and management services. So these things were all around before the public health emergency. But again, therapy had nothing to do with any of these prior to that. So this just gives you the updates as of right now. So for telehealth specifically, this, for the public health emergency, it's approved for private practice, it's approved for institutional providers, including the SNF, and it will end. It will end at the end of the calendar year when the public health emergency ends. So if that is 2021, then December 31st, 2021 will be the last day that therapists can provide any sort of telehealth services. Now, telehealth in each of these virtual services has very specific requirements. Who can and can't do it, and what codes need to be, only certain codes can be billed, and what is the technology that's required to do these things. So for telehealth, you can see the codes listed here. There's very specific codes. If the codes aren't listed here, they can't be provided via telehealth, okay? And again, we did have some good news in the final rule for Part B on January 1st. Some of these codes are going to be moved into a Category 3 listing, which just means there's still a chance that maybe someday we'll be able to provide these services. So they're still on the table, but again, they still will expire. The virtual check-ins, e-visits, and telephone services I don't think are really utilized at all in the SNF setting, but you can look at the qualifiers there and the codes and things like that. Now just be aware that there's some codes and some modes that cannot be provided by therapy assistants. So PTAs and OTAs cannot provide some of the services. They can provide some of the telehealth, and depending on what code you're using, obviously if it's not the evaluation code, you should be good. Okay, so that is there for your reference. Again, there's some more things here for you to bookmark so you can take a look at there's specific to telehealth questions and answers. And if you need to know who your Medicare administrative contractor is for your SNF or for your region in general, you can look at the last link and find out who that is and how to get a hold of them if you have any specific questions. What also happened with the changes were some loosening of the regulations for HIPAA, and that was to allow the virtual services to take place a little easier than what was in place prior to the public health emergency. So there was some relaxation of the audio-visual capabilities and some of the mediums that were not considered HIPAA before that are now acceptable on a temporary basis to use, including things here like you can see in the FAQ bullet, a non-public facing remote communication product allows the intended parties to participate in the communication. And those are examples like Apple FaceTime, Facebook Messenger, video chat, Google Hangouts, and Skype. Other things that are not applicable, you can click on the link and see what is not considered HIPAA compliant. Again, if you're going to provide those services for the long term, it's best to invest in the proper audiovisual communication and portal type platforms that would allow that going forward. Other important links here on the slide will just give you some CDC information and your statistics by state if you want to see the data of what's happening, and also links to all the discipline practice acts for all of the states in case you're having trouble finding yours. We do know that, and keep in mind that your state practice act is what rules. So you have to know your practice act. Just click on the link to find your practice act. See if they put in any specific regulations temporarily for telehealth. I'm sure they have. It's good to know if your state it may not have said anything about telehealth prior to this. They may have something new there, or it may have always addressed telehealth. So take a look at that. That's really important. If your practice act does not approve your therapy discipline from doing telehealth, then you can't do it. It doesn't matter what Medicare says. Okay, so take a look at that. There's also a COVID resource page on our website. The link is at the bottom of this slide, and that is updated chronologically, so you can log into that page and just see what is the newest change that happened, and there's a lot of resources there for you too. Stay safe, and if you have any questions, you can always send us an email, membersupport@monterotherapyservices.com. Thanks, everyone.